And thanks for the opportunity to talk about our revolutionary treatment, as we call it. My name is Anton. I'm a sports scientist from Germany, and it's a pleasure to talk about power spine. This is the name of the treatment, very precise and very specific to approach any forms of back pain in a, we say, specific, quick, effective and long-lasting way. So the concept consists of two machines. One machine is called power spine back, which is designed to approach to the muscles of the lower part of the spine, and the other machine is called power spine neck, which is corresponding to the upper part, to the cervical spine. And these machines are designed for a specific strengthening of very certain muscles. We are talking about very inner layer muscles, and these muscles are most important for the stability of the spine. So we are talking about a local stability. So for that we have to distinguish between superficial muscles and inner layer muscles. And just to give you an overview, the superficial muscles have a kind of dynamic function, and they are responsible for dynamic activities in everyday life, and they are very prominent, very well seen, for example, in bodybuilders. But the problem is that due to conventional exercises, you won't approach the inner layer muscles, because the inner layer muscles on the other side, they are very small, very special. There are a lot of them, and the most important difference is that you can't activate these muscles voluntarily. You can't control them with your mind. So it is difficult to work on these muscles without any equipment. And if we take a look at the current state of science, we know that these muscles are related to chronic back pain. So that means if people are suffering from chronic back pain for a certain duration, there will be guaranteed, or it is guaranteed, that there will be a loss of these muscles, a deficiency, a weakness, and as well we call it atrophy, which means a sort of degeneration. We have to know that all diagnoses, all diseases according the spine are related to a loss of these muscles. So we have to approach these muscles. And as I said, it is difficult to control them, and it's difficult to have an approach due to conventional exercises. And this is why we need a special equipment, these special machines, to have a good approach. And as a client, you would do a conventional, like a treatment, a training, a strengthening training within these machines. These machines have a lot of specifics to adjust individually to your constitution, to your condition, and this will also lead to a very specific effect, especially designed for these inner layer muscles, to build them up again. By now we know that there's a proof that this treatment has a positive effect on these muscles. We prove that due to MRI investigations, and we know that after a certain amount of sessions we will gain a muscle growth and a reactivation of these muscles. We have to know that all diagnoses, all diseases according the spine are related to a loss of these muscles. So we have to approach these muscles. And as I said, it is difficult to control them, and it's difficult to have an approach due to conventional exercises. And this is why we need a special equipment, these special machines, to have a good approach. And as a client, you would do a conventional, like a treatment, a training, a strengthening training within these machines. These machines have a lot of specifics to adjust individually to your constitution, to your condition, and this will also lead to a very specific effect, especially designed for these inner layer muscles, to build them up again. By now we know that there's a proof that this treatment has a positive effect on these muscles. We prove that due to MRI investigations, and we know that after a certain amount of sessions we will gain a muscle growth and a reactivation of these muscles. It's different compared to, let's say, gym exercises where you have to do 3 times 15 repetitions to achieve a fatigue of these muscles. Here we know that is, because it is very isolated and very specific, we know that just one set of 12 repetitions in a very controlled and cautious way will lead to a very nice effect. And due to the procedure of, we say, around about 20 sessions are required to achieve a very good effect, to build up muscles, because it takes time. It's not like taking painkillers and pain is relieved. We want to build up muscles to achieve a sustainable effect, and for that it will take some time. But during the 20 sessions, we will increase the intensity step by step. We will adjust, we will adapt to any things which might occur, and then we will get a long-lasting effect to achieve a good stability. To give you an overview, we are doing this treatment now for more than 20 years in Germany, in our hometown, and we already have a lot of partners all over the world, so around about 40 centers, 40 places, using this concept in different purposes. Like some gyms use it for a healthy approach of the concept. We have doctors, physicians, orthopedics, general doctors. We also have hotels, rehab centers, and also physiotherapists. So it is quite flexible to adapt this treatment to different concerns. And from our perspective, after treating more than 22,000 clients in Germany, we know that the best approach would be to do it in a preventive way, because we are talking about a strengthening treatment. We want to build up muscles, and to achieve that, we have to create a certain stimulus. This stimulus is required to create or to force adaptation within your body. But also this treatment is designed to adapt to certain diagnoses, because after 20 years of experience, we know how to handle different situations, like whether it is an old client, a younger patient, severe situation after a surgery, or a preventive way. We know the preventive way, that's the thing about it, that would be the best, because this will guarantee a very high percentage of success. While on the other side, after a lot of investigations, according to different diagnoses, we know that in some cases we achieve 90% of pain relief, of really high pain relief success. So we did an own investigation with our own clients, because my boss, his name is Dr. Florian Maria Alphen, and he's a surgeon. And that's a very interesting situation, because in Germany, these two parts are like opponents. The one side is the surgery part, and the other side is the conservative treatment part. And usually they are kind of fighting against each other. But from our perspective, we know both sides. We know the surgery area, and we know how it is like to do it in a conservative way. And I can tell you now from my own experience, because I did this treatment to clients, I don't know, for 5 years, and I know a lot of clients which have been literally pulled out of the table for the surgery, like because they had already indications to perform a surgery, and then they visited our center for a second opinion, and we told them, okay, look, your appointment for the surgery will be in 3 weeks. That's a long time to go, because it wasn't possible to get an earlier appointment. And then we start with them to do the treatment at the same day. And some of them, they canceled their appointment because of it improved amazingly. And that was, for us, it was like, okay, that's the benefit not only to the client, also to our socio-economical aspect, because you know, the costs are increasing, the amount of operations, the amount of clients are increasing, I think, in almost every Western nation. So this is gonna be a game changer according that #1 worldwide issue, back pain. The development of fitness industry, health industry, and the amount of patients and the costs which are increased in the last 30 years. And it seems to be like there's no effect of doing calisthenics, training, exercises in gyms, because I think we 5 times increased the amount of socios in our gyms in Germany, but still in the same duration the amount of operations was doubled or more than doubled. And somehow it's weird, because we know why it's not effective to do conventional training, because it's not approaching these inner layer muscles. This is the explanation to that issue. And on the other side, we have athletes, professional sportsmen with a herniation similar like the picture you showed me, and we avoided a surgery, even with this severity of the diagnosis. A lot of clients visit our center with MRIs, and then we can show them the relation between the duration of pain, so in most cases chronic pain, and we can directly see, oh look, there's an amount of fat infiltration, there's a lot of fat tissue within these inner layer muscles, and this is the best proof for the atrophy already taken in. And for that, now we know that there is a possibility to change that again due to this treatment. We know after a lot of investigations that it is possible to build up these muscles again, and this always comes together with a release of pain in more than 90% of our clients.